Good morning, everybody. I call this hearing to order. I request unanimous consent that the chair is authorized to declare a recess at any time. Hearing no objection, so ordered. Without objection, members will be recognized in order of committee seniority for questioning witnesses today. This will make it easier for me to ensure all members participating have an opportunity to be recognized. I want to welcome everyone to today's Economic Opportunity Subcommittee hearing, where we're discussing veteran homelessness in the wake of the COVID-19 pandemic. Ending veteran homelessness remains a critical priority for this committee, and we're pleased the administration continues to elevate this issue as well. Incredible strides have been made to end veteran homelessness in the last decade. Since 2010, efforts by federal and local agencies and community partners have cut the number of homeless veterans nearly in half. 3 states and 82 communities have virtually ended veteran homelessness. While I appreciate the extraordinary results that government agencies and community service providers have produced, there is much more work to be done to end veteran homelessness nationwide. The year-over-year reductions in the rate of veteran homelessness have stalled in the last 2 years. Unfortunately, even before the pandemic took hold, we were already seeing the number of homeless veterans tick slightly upward. On a single night in January 2020, the HUD point-in-time count estimated that 37,252 veterans were experiencing homelessness, an increase of 167 veterans since January of 2019. This issue hits close to home for me as a lifelong Californian. It's disheartening that the Golden State continues to see not only the highest rate of veteran homelessness, but the highest rate of unsheltered veteran homelessness. However, veteran homelessness is not confined only to major U.S. cities or a single demographic, and this committee is committed to identifying and eliminating the barriers to stable housing that any veteran may experience. In 2020, roughly 17% of all homeless veterans were counted in rural areas where it may be more difficult to access care and resources. Black veterans are overrepresented in the homeless veteran population, constituting 1/3 of veterans experiencing homelessness and 1/4 of veterans experiencing unsheltered homelessness. Further, in contrast with the overall homeless population, in which women were more likely to be sheltered, women veterans experiencing homelessness were more likely to be found in unsheltered locations than their male counterparts. We haven't yet received data from the 2021 point-in-time count, but the pandemic has likely worsened these trends. So today we'll discuss how COVID-19 altered service and care delivery for veterans experiencing or at risk of homelessness. We'll hear from 3 federal agencies, VA, HUD, and USICH, about their partnerships to provide vital housing resources to vulnerable veterans. Local and national veteran service organizations will also provide their expertise, and we'll discuss how communities are responding to the pandemic in their work to serve the homeless. We'll discuss emerging trends related to housing instability and the efficacy of programs aimed at preventing homelessness and the pandemic. We'll also examine the fiscal year 2022 budget request for VA homeless programs and identify the ongoing support needed to prevent and ultimately end homelessness among veterans. And we'll hear updates on VA's implementation of several measures Congress has passed in the last 15 months to achieve this goal. In March 2020, we passed the CARES Act, which provided nearly $20 billion to the VA, of which $971 million was directed towards homeless programs. This funding bolstered highly effective programs such as SSVF, GPD, and HUD-BASH to rapidly rehouse and provide access to permanent housing for veterans and their families. This past January, my legislation, the Johnny Isakson and David Rowe Veterans Healthcare and Benefits Improvement Act, was signed into law. It included significant policy changes to increase flexibility for VA to deliver care and resources to homeless veterans. For example, it allowed VA to use appropriated funds to directly provide food, shelter, clothing, blankets, hygiene items, transportation, and communications devices to homeless veterans during the pandemic. Isakson Rowe also addressed existing barriers veterans may face when seeking stable housing. It provided solutions like establishing a grant program to administer legal services to homeless veterans and requiring underperforming VA medical centers to enter into contracts with community providers for HUD-BASH case management. Also in January, the fiscal year 2021 National Defense Authorization Act provided a meaningful, needed expansion to HUD-VAS eligibility. Now, chronically homeless veterans with other than honorable discharges can access the housing vouchers and case management provided by the HUD-VAS program. This expanded eligibility will provide permanent supportive housing to veterans who previously did not have access. Most recently, in March, the American Rescue Plan provided another funding infusion to VA, including nearly $500 million to bolster the department's homeless programs. I look forward to hearing about VA's progress in utilizing these resources and what more this committee can do to help. I'm also concerned that we may see a further increase in housing insecurity among veterans as housing costs continue to rise and protections put in place in response to the pandemic expire. One veteran without a stable home is one too many. And together, today we'll explore long-term solutions to ensure that every veteran has access to sustainable, safe, permanent housing. We have a lot to cover today, so I'll conclude my comments and recognize my friend, Ranking Member Moore, for any opening remarks he may wish to make.
Thank you, Mr. Chairman. I'm pleased to be here with you today to address a very important topic of homelessness among our nation's veterans. As I've mentioned in previous hearings, I wish we were holding these hearings in person, especially now that Washington, D.C. is almost fully reopened. I hope that we can get back to in-person forums as soon as possible. While the VA, HUD, and other agencies and thousands of government and nonprofit partners have made great strides reducing homelessness among our veterans, we are now staring down a new challenge. There is no doubt that COVID-19 has impacted the lives of all Americans, and the sluggishness of the Biden economy will have an impact on homelessness among the veterans for the months, if not years to come. We also know that the eviction moratorium and forbearance rules from the VA and non-VA mortgages are going to have an impact on those seeking assistance. Congress has stepped up by providing $1.4 billion in extra dollars for VA homelessness programs and as part of the CARES Act and the American Rescue Plan. Congress also recently passed sweeping new rules in the Roe Isaacson law to provide flexibility for providers and the VA to respond to the impact of COVID. These changes include increasing the grant and per diem rate and streamlining case management rules so the VA can ensure housing vouchers are being utilized. While I will always prioritize improving services for veterans, I think it is fair to begin asking questions about how much money for these programs is enough and if the funds are being used effectively. According to the latest point-in-time count, I think you referred to earlier, Mr. Chairman, there are 37,252 homeless veterans on the night of January 2020. We should expect this number to be even higher now with the impact of COVID-19. However, if we assume that this number would double to 70,504 veterans, the amount of funding Congress will be providing to the homeless veterans programs at the VA through the fiscal year 2022 request, combined with the leftover funds from the American Rescue Plan, that would equate to $41,963 per homeless veteran. To most Americans, that's a lot of money and still doesn't include the cost of housing vouchers provided by HUD and other government expenditures. To be clear, I'm not saying this amount of money is too much or it isn't justified. I'm just saying that we should be asking the question about how this level of funding is used or is meeting the needs and working to eliminate veteran homelessness. For example, we know that there are still thousands of unused HUD/VAS vouchers that could immediately house homeless veterans. Why are these vouchers not being used? And what can we do to help to eliminate the red tape and ensure veterans are housed? We should also be asking the Department of Labor questions about how job training and employment services could be helping these veterans to find gainful employment and other critical pieces of the puzzle. I also know that one of the largest hurdles in veterans homelessness is addressing the high cost of living and the lack of affordable housing in certain areas in the country. I'm curious as to how we address that and increase housing stock. I was pleased the House recently passed Mr. Mann and Mr. Pappas' proposal to sell the unused VA-owned properties to public housing authorities and providers. This would help these agencies house homeless veterans by increasing the housing stock. I urge your Senate colleagues to quickly pass this proposal. Before I close, I do want to thank Ms. Lula Sharonik with Veterans Priority for being here with us today from Alabama. I am excited to hear about the innovative programs that they are using to help my district and my state's homeless veterans. Thank you all for being here. I look forward to your comments and recommendations. With that, Mr. Chairman, I'll yield back.
I thank the ranking member. I certainly share your desire to get these back in person. And I have to tell you, it was so nice to see everyone's smiling faces when we got back and we're able to see each other in person on the floor the other day. So things are getting better, and certainly hear what you're saying. I think my staff knows I'm ready to get back in person. So it's great to see everybody. We have some great witnesses today. For our first panel, we'll hear from representatives from non-governmental homeless service organizations. First, we have Catherine Monet, Chief Executive Officer for the National Coalition for Homeless Veterans. Welcome back, Ms. Monet. It's always great to see you. Thank you for all you do. Next, got to give a shout out to San Diego. We've got Akila Templeton. It is so nice to see you, President and Chief Executive Officer of Veterans Village of San Diego, and thank you for all the wonderful work you're doing in our community. I'd like to give Ms. Templeton a special introduction as a new witness and as a member of the San Diego community. And we were just together recently at the San Diego VA. They are doing a tremendous job at VVSD, and we're very grateful to Ms. Templeton for being here. She's an experienced organizational change expert and a leader whose career in mental health, substance abuse, veteran services, and homeless services spans more than 25 years. She joined VVSD in August 2020, having previously served as the executive director of the Inglewood site of US Vets, the managing director for Phoenix House Los Angeles, and enrolls at the Los Angeles County Department of Mental Health and Ventura County Department of Behavioral Health. Ms. Templeton is a master's level addiction specialist holding a Master of Social Work from the University of Southern California, with a concentration in military social work, as well as a Master of Public Administration with an emphasis in organizational leadership from my dad's alma mater, California State University, Northridge. So it is great to see you, Ms. Templeton. Thanks for being with us. And finally, we have Lula Skiranek, the Director of Priority Veteran, who is joining us from Ranking Member Moore's home state of Alabama. And it's great to see you as well. Welcome to the Economic Opportunity Subcommittee. With that, I will now recognize Ms. Monet for 5 minutes.
Chairman Levin, Ranking Member Moore, and distinguished members of the committee, thank you for the opportunity to join you. NCHV is the Resource and Technical Assisted Center for a national network of community-based organizations that provide housing, shelter, and supportive services for thousands of homeless, at-risk, and formerly homeless veterans each year. We thank you for your leadership in continuing efforts to break through barriers and provide $1.4 billion in supplemental resources for the veterans that our coalition serves across the country. As you know, veteran homelessness increased slightly between 2019 and 2020, even prior to the pandemic, so the next few years will prove critical in national efforts to address this problem. We at NCHV are pleased to see the current administration reprioritizing veteran homelessness once again. The last time I spoke to this committee, I noted challenges the pandemic has created for veterans experiencing and at risk of homelessness, from difficulties finding shelter, housing, and supportive services, to reporting, testing, and vaccination access, to feelings of isolation that exacerbated mental health issues. Much has been accomplished since then, but certain challenges remain. And my genuine hope is that your partnership will ignite progress that turns this once-in-a-lifetime crisis into a once-in-a-lifetime opportunity to build a brighter future for veterans, a future where none have to make the hard choices between putting a roof over their head or food on the table for their families. As communities are starting to turn the corner on infection rates and vaccinations are increasing, many communities are starting to lift emergency declarations, tighten access to unemployment benefits, and wind down state-level eviction, foreclosure, and utility shutoff moratoria. With the impending expiration of the CDC's national eviction moratorium, this could result in an unprecedented wave of veteran homelessness. The expansion of SSVF, along with the rollout of emergency rental and foreclosure assistance, help address this, of course, but homelessness is often a lagging indicator. So we're hopeful that the administration will continue to address veterans within the greater scale of the COVID-19 response. As you indicated in your remarks, Chairman Levin, it is evident that people of color have been disproportionately impacted by COVID and the economic crisis that it's caused. They're also disproportionately represented among the homeless population. So as we work toward recovery, we also need to look at making sure that all responses to this pandemic, future emergencies, and just program design in general, right, are looking at how we equitably center the needs of veterans of color and other vulnerable subpopulations that aren't getting served at the same rate. We also need to look at the systemic and institutional factors that have contributed to this phenomenon to rewrite the story for future generations of veterans. My written testimony has a lot of detail in it related to the VA budget and appropriations. And we are truly thankful that Congress has continued to support these programs. I think there are two things that I'd like to highlight. And the first is that I do not believe that the president's budget request contains sufficient funding to see homeless and housing unstable veterans through this crisis. And the second is that if we're to move out of this emergency and continue to decrease veteran homelessness and implement all the really great program changes that you all have enacted into law and incorporate the new things that we're seeing in proposals that look really great, we're going to need sufficient funding, and it's got to be incorporated into non-emergency appropriations and authorizations. We can't just keep getting emergency one-shot tranches at funding. So there are a couple of big things that really need to happen in order to address the needs of housing insecure veterans. And the first is affordable housing, right? Most of us want the best for our families, but our country remains amid a housing affordability crisis affecting veterans and civilians alike. We need to rewrite the rules to make sure that housing is considered a right for veterans and for everyone, right? In the last decade, we know rental prices have increased 66% and the federal minimum wage has done nothing. And so there are a lot of folks who are homeless, cost burden, and we need Congress to change that, right? You all can make meaningful progress toward ending homelessness for everyone by enacting legislation to make housing a right, offering subsidies, looking at deep investments in affordable housing, and making sure that services are still there to support people who need them. We also need to look at the HUD-VASH program and think about how we can deploy that program more effectively as interim hotel and motel shelters wind down. Housing authorities should be encouraged to project-based, and you all need to make sure that VA's got the resources that it truly needs to provide the level of case management that veterans require for housing stability. Grant and per diem recipients and grantees have also found that GPD rates are insufficient to run these programs well in high-cost areas. And so we request that you maintain the enhanced GPD rate at 300% post-emergency and require VA to work with community partners to identify a way to separate GPD payments from the state home per diem rate. We do appreciate the flexibilities that you all have granted to make it easier for providers to take advantage of capital grants to improve their congregate facilities in the light of the public health emergency. But the recent capital grant NOFA, if fully disbursed, would only improve about 1 in 8 congregate beds in VA's inventory. So we request that you fund future rounds of capital grants and regular non-emergency funding. We request that you allow folks time to do appropriate planning and construction, and that you extend the waivers of the real property disposition and matching requirements. Providers have also raised concerns about the structure of the grant, including the award limitations and the inability of providers who are already at the per diem cap to request a higher per diem in support of 24/7 staffing at multiple sites. As we move out of a crisis response phase, we need to ensure that supportive services such as employment and health navigation are available for veterans. So we request increased investment in the HVRP program and in other supports for veterans exiting homelessness. Thank you for the opportunity to speak with you today. We're currently in the middle of an emergency, and veterans experiencing and at risk of homelessness need safe housing now more than ever.
Thank you very much, Ms. Monet. I now recognize Ms. Templeton for 5 minutes.
Greetings, Chairman Levin and Ranking Member Moore. Hello. Thank you for the opportunity to address the committee. Today, I humbly address you not only as a leader in the fight to end veteran homelessness, but also as a COVID-19 survivor. I share this because it provides some insight into what it has been like for all of us since COVID-19 made its appearance in the United States. We have been both in line and on the front line. We have provided help while also needing help to manage our own lives. Today, I want to talk to you about the heart and soul of our industry and how this virus has helped us to come together in ways before unimagined. COVID-19 has forever changed my opinion about what is possible in the veteran service space. I know that we can solve the problem of veteran homelessness if we choose to approach it with the same sense of urgency used to respond to the virus. Our response to COVID required that we think outside of the box, that we act quickly, take risks, and put our differences aside. We had one goal: to beat COVID before it beat us. At the local level, I saw collaboration unlike any I have ever seen. I saw flexibility at the state, county, and city levels. I saw elected officials and government agencies listen to providers and work with them to coordinate the response. I heard yes more than I heard no. We worked together to fight a common enemy, and we were willing to try anything if it meant keeping people safe. So from on-site testing to massive food drives and everything in between, we got it done, especially here in San Diego. Thank you, Chairman Levin, for your support. At the federal level, you responded with legislation that gave us the resources needed to maximize our efforts, reduce risks, and save more lives. With help from the CARES Act, we brought more veterans in from the street and fought harder to keep up with the larger numbers of veterans entering homelessness for the first time. We were able to place homeless veterans with advanced age and pre-existing conditions into non-congregate living settings like hotels. We were able to help veterans at risk for becoming homeless keep up with monthly rent payments and household expenses. CARES Act funding meant that for the first time, we could be compensated at per diem rates needed to provide quality care to veterans living in our emergency housing programs. We could provide PPE to our workers and veterans. We could purchase equipment to sanitize our facilities, and we could invest in 21st century technology so that telehealth services were readily available. Our response to COVID proved that we can put our money, time, and effort where it matters when we agree that a problem is worth solving. Earlier, I mentioned that I had been diagnosed with COVID-19. Many of our employees were also diagnosed. Henry Geiger, a driver in our transitional housing program, lost his life to COVID, but had shown up to work every day in the weeks leading up to his diagnosis. I need you to know that there were people on the ground who showed up to Zoom meetings even after being diagnosed. They worked from home while isolated. Employees that were not diagnosed continued to show up even though they were at risk. They showed up even though they had friends and family members and coworkers who were dying. They were helpless and afraid in many instances, but they continued to show up for our veterans. That is how we have shown our commitment and dedication to the people we serve. We do not control the purse strings that fund our programs, and we do not vote on the legislation that can give us what we need to do our jobs. All we can do is show up. That is what we ask of you all. Just continue to show up. Give your all, work across the aisle, work together to keep the momentum going, even as the threat of the virus diminishes. When COVID fades away, there will still be homeless veterans, and that is unacceptable. Soon, COVID will no longer be a threat, but I submit to you that poverty is and will continue to be a public health crisis that puts millions at risk annually. Homelessness is a public health crisis. Veteran homelessness is a public health crisis and our greatest shame. I need you to understand that nonprofit veteran service organizations offer a valuable service, not just to their local communities, but to this country. We serve the most vulnerable in society, and in our own way, we are providing access to the American dream by restoring the one ingredient necessary to obtain it: hope. The American Rescue Plan Act and the $17 billion set aside to support veterans is a step in the right direction. Going forward, we want you to continue to pay grant and per diem rates that make sense. We want you to intentionally advance a framework for equity and justice as funds are made available to bring us out of this pandemic. We want you to think about the lasting effects of the virus and the collective trauma that we have all experienced. We have miles to go before we can claim a victory over the virus, but we are getting there. The last year has shown that as a nation, we can adequately address problems when we see them as problems that are worth solving. Veteran homelessness is a problem that is so worth solving. Thank you so much for everything you have done, Chairman Levin. You are a true ally. Thank you.
Well, thank you so much, Ms. Templeton. And I just want to express our deepest condolences to your team and to the family of Henry Geiger, who you just mentioned, who I know was a driver for your transitional housing programs. And
Yes.
We're thinking of you. I want to now turn to Ms. Skowronek for 5 minutes. The floor is yours. Thanks for joining us.
Good morning. Chairman Levin, Ranking Member Moore, members of the committee, thank you for the opportunity to testify on the work we do with veterans facing homelessness. I'm the Program Director of Priority Veteran, a program of United Way of Central Alabama. Priority Veteran started in 2013 with a Supportive Services for Veteran Families, or SSVF grant from the VA. Since then, we have served over 3,500 veterans across Alabama by providing case management, supportive services, and financial assistance. COVID-19 forced us to change our entire service model. Priority Veteran and other SSVF grantees were called to action by John Kuhn, the National SSVF Program Director, who emphasized we should do whatever it takes to ensure no veteran is on the streets during this pandemic. SSVF recognized homeless veterans were at high risk for COVID-19. The shelters our clients previously relied on were no longer safe. In response, SSVF expanded our ability to place veterans in hotels as an emergency housing option while awaiting permanent housing. Since March 2020, Priority Veteran has placed 170 veteran families in hotels. At the peak, we had 67 veterans in hotels all over the state. Now only 6 remain in hotels. Priority Veteran had several clients with no income, no transportation, and therefore no access to food. Through expanded SSVF guidance and a creative partnership with a local catering company, Priority Veteran provided 1,370 meals to veterans in hotels. The pandemic created not only a public health emergency, but also an economic crisis. 32% of families we served during the pandemic were facing eviction. Many owed thousands of dollars in back rent and utilities. Because SSVF increased grant funding and lifted caps on the amount and length of financial assistance that could be provided to clients, Priority Veteran was better able to keep veterans in their homes. Priority Veteran works closely with the VA medical centers and BASH teams in our area, and the pandemic only strengthened these partnerships. We now often work in tandem with the veteran while they're in a hotel stay and searching for housing with a HUD-BASH voucher. Also this January, the Birmingham VA and United Way of Central Alabama launched a veterans vaccine clinic, and to date, nearly 50,000 vaccines have been provided. Even with increased SSVF funding, though, Priority Veteran clients face ongoing challenges, including a lack of affordable housing and high rent. Most landlords are unwilling to house a veteran with poor credit, criminal history, or past evictions. When SSVF expanded our ability to place veterans in hotels, it became apparent how many were already using extended stay hotels as their primary residence, not because they didn't have income, but because they couldn't find a landlord willing to rent to them. Lack of mental health care is another challenge. As we placed more veterans in hotels, it became clear that mental illness made it difficult for many to live alone in a hotel room, leaving them without a safe option. Priority Veteran was excited to learn that HUD-BASH will extend eligibility to veterans with an other than honorable discharge status, and about the countrywide expansion of the shallow subsidy program. These changes will create long-term stability for veterans who have fallen in and out of homelessness. Charlie is an example of a challenging but ultimately successful case. He served in the Army in 1985 for only a few months and lived on the streets for 2 years before receiving help because he assumed he did not qualify for any veteran programs. With access to the VA Squares portal, we quickly determined his SSVF eligibility. Previously, Charlie would not stay in shelters due to his anxiety, but he did feel comfortable in a hotel room. Charlie stayed in a hotel for 17 weeks while we worked with a permanent supportive housing provider to secure an apartment. Without that extended hotel stay, it is unlikely Charlie would be stably housed today. I have been amazed how local programs and government agencies have risen to the occasion and made changes to ensure our most vulnerable heroes have a safe, stable place to call home. I'm incredibly proud of the work Priority Veteran does, and I am honored to have the opportunity to speak with you today. Thank you.
Thank you so much, Ms. Skowronek. With that, I recognize myself for 5 minutes to begin the question portion of the hearing. Ms. Templeton, when I think of the great men and women that work at Veterans Village of San Diego, I think about how they helped us pull our region through the pandemic. And I think there are people like that all throughout this nation that have helped pull this nation through the pandemic. And we owe everybody that works at VVSD and all similar organizations across the country a huge debt of gratitude. I so appreciated the strong words in your written testimony that we need to respond to the homelessness crisis just as we responded with the same urgency, the same focus as we responded to COVID-19. And transitional housing providers like VVSD are serving a critical role in helping veterans access the housing and supportive services they need. Can you please discuss how Veterans Village used the grant and per diem waiver to provide care and services to veterans and their families?
Absolutely. We know that the rate for similar care in other settings is significantly higher than what the per diem rate was originally. This allowed us to have adequate staff. It allowed us to provide more nutritious meals. We were able to purchase more supplies. We were able to create spaces that were safer. Social distancing was a huge challenge for us. And so, with the increased funds, we were able to create more spaces that veterans could use in our transitional housing program so that they can remain safe. Telehealth was a big deal during this time. And so we were able to use funds to purchase new equipment so that we could continue to provide services, even though we had fewer staff available at the site. And so the increased funds not only helped us to do some things that we were not able to do prior, and not only did those funds help us to keep in line with some of the guidelines set by the CDC, but it also helped us to just do the everyday work of taking care of our veterans. We were struggling before. A lot of our programs required subsidies. You know, we would use funds from other sources to make up the difference. And so this gave us a little breathing room. We were able to provide those services with confidence, and we didn't worry about where the funds were going to come from. And so I think just that peace of mind, just knowing that we could do our work from day to day in the midst of a crisis, that in and of itself was extremely valuable.
And fair to say that you would support an extension or permanent authorization of the GPD waiver, yes?
Absolutely. So this was, I think, a priority even before the pandemic hit. We've been screaming that, we just need more. We cannot do it, at the existing rate. And so I think that the pandemic proved that, the funds were needed, and that we will be good stewards of those funds, and that we're able to support our veterans in more meaningful ways.
Thank you for that. Ms. Monet, I want to turn to you at the time I have. In your written testimony, you stated that the administration's budget for HUD-VASH is insufficient to meet veterans' needs because HUD doesn't request funding for new vouchers that'll be needed to move veterans from motel placements into permanent housing. HUD's budget states this is because previously appropriated funds that remain available are sufficient to fund new voucher allocations. At the same time, many existing vouchers remain unused for reasons including VA case manager shortages, which we've repeatedly advocated to address. VA requested about a 5% increase in case management funding in fiscal year 22. In your view, is that sufficient to ensure every voucher is paired with robust supportive services?
No.
No. And until the underlying issues that affect voucher utilization are addressed, what are our prospects for effectively ending veteran homelessness?
Voucher utilization is one metric, right? And vouchers are truly one of the most surefire ways to move veterans on from homelessness into permanent housing. But I think that there are probably other mechanisms that you can lean on, including SSVF and other resources out in the community to get that done. Now, I do think that having vouchers sitting unutilized is a terrible waste of appropriated funding. And so I think we have been working with your staff and your team to push VA to utilize more of its vouchers more quickly and more efficiently. And I think probably in their testimony, you'll hear about their increased staffing rates, but I do think that contracting is an acceptable approach. One thing I would note about that is that it would be really helpful if nonprofit organizations like Ms. Skronik's and Ms. Templeton's could be considered for those contracts. And if we could ensure that they are in the running because they are proven organizations that know how to serve veterans well.
Thank you so much, Ms. Monet, and thank you again to Ms. Templeton for all your good work in San Diego. With that, I'll recognize the ranking member for his questions.
Thank you, Mr. Chairman. Ms. Skronik, what has been your experience dealing with the various federal level of homelessness programs? And what are some things you believe we can do to improve upon the quality of services that we provide to homeless veterans?
Thank you. Well, I would agree with the other panelists. HUD-VASH vouchers are a huge, important tool for us. What we have found in Alabama is that we need them available in all counties. We're facing situations where a veteran is making the choice of whether to leave their hometown, small town, to go to one of the larger areas like Huntsville or Birmingham, where there are more vouchers available. As I mentioned, the expansion of the shallow subsidy program is really a game changer for us, and the availability of VASH vouchers to other than honorable discharges, because those really are, the other than honorable ones are the ones we're really stuck on. So many of the veterans we serve have an identified disability. We certainly connect them with the wonderful job readiness programs, the Alabama Career Center, other specialized veteran employment programs, but there are some that are going to need ongoing assistance to be able to stay stably housed.
So you're thinking the ones who are discharged dishonorably then, or maybe there's some mental health issues, or they kind of falling through the cracks? Is that kind of what you're seeing?
Yes, I think there's certainly sometimes a link there. And so because they have greater needs, those greater needs may have been the same things that led to the issue with their discharge that are also making it difficult to stay stably housed.
I got you. Do you have any idea on the percentages of dishonorable and honorable discharge veterans that would be homeless? Usually, have you ever had a chance to kind of research that? Or
I do not have that number available to me right now.
Yeah, it was just a question I was thinking through the process. I could see where the mental health issues could cause the homelessness, which might have caused the dishonorable discharge. And then what is the direct correlation between the percentages is kind of the question, I guess. But
right.
But let me ask you another question too. In your testimony, you stated that at the peak of COVID-19, priority veterans had placed 170 veteran families in hotels, with 6 remaining in hotels today. Have you been able to place those 164 families in permanent housing?
We placed the majority of them in permanent housing. Some of them moved out of the state for other opportunities. Some of them, frankly, disappeared. As I said, we also had a significant issue with the mental health of some of the people needing the hotel stay. And so staying in a hotel was very difficult for them.
I got you. Ms. Monet, I got a question for you, please, ma'am. Can you tell us why you believe it's important for the VA to release the data on the number of homeless veterans that are treated by the VHA for COVID-19?
Well, I think it's important just to understand the true nature of the challenge, right? I think you can't really solve a problem until you know how big it is. You can't target interventions or address issues if you can't see where they are. So for example, I think there has always been a lot of concern about congregate facilities and safety, and VA has been moving quickly to address that, but I don't think I've seen any data on the unsheltered population of veterans and whether COVID is spreading in that population as well, and whether there should be more interventions targeted specifically to that population. So I think having a better understanding of that data can help address problems more effectively.
I got you. Thank you so much to the panelists. Mr. Chairman, with that, I'll yield back.
I thank the ranking member for his questions. Let me now turn to my good friend from New Hampshire, Mr. Pappas, for 5 minutes.
Well, thank you very much, Chairman Levin, and thank you to the ranking member as well for holding this hearing today. And I want to thank our panelists for their comments and for all the work that you do. I think it's very clear to us all that as one crisis ends, there are others that persist, including the crisis around veteran homelessness, as well as homelessness generally and affordable housing in our country. And we appreciate all your thoughts on these matters. Ms. Templeton, I really appreciated your comments about those who work for frontline organizations who have been assisting homeless individuals and the great risk that they have put themselves through over these last many months to ensure that people can receive services, maintain shelter. And that's been really important to address these twin crises of this health pandemic as well as homelessness. So we appreciate your efforts. And in addition to that, I appreciate your thoughts too about what steps have been taken during this pandemic that we can continue to apply to this matter moving forward. And the need for resources, the need for flexibility is absolutely there. And so I hope our committee can work on some of those areas to make sure that we are addressing this problem head on. Ms. Monet, I wonder if I could ask you a question about the expiration of eviction and foreclosure moratoriums. I share your concern about this and the impending end of these moratoriums and the impact that it's going to have on housing security for veterans. Wondering if you can share thoughts on how VA and HUD can best prepare and respond for the end of these moratoriums to ensure that our veterans have access to safe and sustainable housing solutions, assuming that some are unfortunately going to be caught up in the end of these moratoriums.
Well, I want to start by rejecting the premise of your question, sir, respectfully, because I think I'm of the opinion, right, that we shouldn't necessarily be ending these eviction moratoriums and foreclosure moratoriums, right? I don't think the economy has recovered to a point where people are able to sort of cover all of these expenses and have all gone back to work. I think one of the things that you need to know about some of the people who will be most affected, right, are that a lot of the people who are most likely to be evicted, or I think if you look at data mapping, I guess, right, there is a direct correlation between communities where there are high rates of eviction and low rates of vaccination, right? So when you think about the people who are most likely to be impacted, these are like the same group of people. And I think that's a huge problem. But if there is no congressional action or administrative action, right, to enhance and I guess make the eviction moratorium extend out further, right, I do think that we have to look at how we pivot our resources to ensure that we're helping people stay housed, but that we're not doing that at the expense of helping folks who are still unsheltered, right? There is kind of a careful balancing act that VA and HUD have to look at. And I think to some degree, right, there may be some looking at how some of the HUD emergency rent assistance funding could potentially be paired with SSVF and kind of trying to innovate around that. I think that would be probably the best stopgap, but I'm not sure that it's a good one.
Well, I appreciate those comments, and I think, in the absence of any extension, I think we have to be prepared for what might happen next. And, one of the areas I think we've got to look at is, where these moratorium ends, it might end in high cost areas, what opportunities are available to, those individuals. Do you anticipate that we would see a surge in unsheltered homelessness, and particularly these high cost areas under that scenario?
I think it's entirely possible. And I think back to NCHV's toll-free referral line, and in the middle of the summer when there was that short gap between, I think, the federal eviction moratorium and when the CDC moratorium came online, we got so many calls from people, and they weren't all from high cost areas. I think to some degree, the challenge may be more not high cost areas, but communities where your judicial system churns through evictions at a faster rate so that people are put out quicker. I think that's probably more what I would be worried about, is the speed of the system, and then what do we have in place to move people up back into housing.
Well, thanks for your comments. I also appreciate your comments about the need for additional funding, and not just on an emergency basis, but in a way that organizations and our federal agencies can really plan and deploy these dollars over time in an effective manner. So thank you for raising that issue. I appreciate all the comments of our panel, and I'll yield back my time.
Thank you, Mr. Pappas. I now recognize the gentleman from North Carolina, Mr. Cawthorn, for 5 minutes.
Very good. Ranking Member Moore and Chairman, thank you very much for your time tonight. Before I begin, I would just like to speak on the last round of questioning that we were just hearing. I cannot reject what I just heard more strongly. The complete reason that this moratorium was going on is because people were not able to go out and get a job because of the COVID-19 pandemic. We currently have 9 million job openings in this country. Everywhere, I'm sure every single person on this panel and that's listening to this has gone to a restaurant where they have told you, oh, you know what? Actually, we're going to have a little slower service tonight because we can't get people to come back to work, because the federal government is literally sending people paychecks to sit at home. It's absolutely ridiculous. The paychecks have got to end. The moratorium on rent has got to end. It's absolutely insane. It's destroying so many of these landlords' lives, the entire lives that they've worked to be able to have a life where they can live like this in the later years. And now it's being completely destroyed because so many people are unwilling to go out and get a job. It's disgusting and it's un-American. Ms. Skorinek, in your written statement, you commented that there are challenges of working with landlords to use housing vouchers. What are some of the strategies that you believe we should be examining to address this issue?
Well, it wasn't specifically those landlords to use vouchers. It's having landlords accept tenants who don't have vouchers, but also have bad credit, past evictions. You know, once you become homeless, you pretty much shot your credit. And so what we do is a lot of landlord recruitment. We try to encourage them to take a risk on this particular veteran based on the fact that they'll have the support of our program, that they'll have some case management services following them, trying to resolve any issues. But in, you know, the way things are today, it's, you know, they have great access to people's credit reports, all that information, and it's just easy to say no. So it's a big uphill battle getting new landlords to say yes.
Well, I completely understand that. I do think a big problem with our society is that we've forced so many Americans to have to worship at the altar of a FICA score, and it's absolutely ridiculous. So, but anyway, thank you for those words. Ms. Templeton, moving on to you, if you don't mind. In your testimony, you talked about how the relief funds from the CARES Act and the American Rescue Plan helped combat COVID-19 within your organization. Aside from PPE, would you mind to elaborate on how these funds were spent and what you feel helped the most to combat this pandemic, just in case we're faced with something like this in the future?
Yeah, sure. So, you know, just having adequate staffing, we needed emergency staff to fill in for people that could no longer work, people that had childcare issues. We had to increase our mental health service offerings. So making sure that we had licensed providers on site to deal with and combat crises. We had to respond to crises that were happening daily. So making sure that people had transportation to get back and forth to medical appointments. We weren't able to, simple things like we couldn't put, you know, multiple veterans on one bus. So having drivers that could make multiple trips, I could go on and on about the unanticipated, you know, consequences of having to really keep up with the guidelines that were coming out, you know, almost daily, and the need to pivot daily. We have a huge you know, site here. We offer services just at our main site. We have over 300 beds, and we have 5 additional locations throughout the county. And so just, you know, being able to provide resources and respond to emergencies and the need to really do what was expected at the county and state level daily took an enormous amount of resources. It costs money.
Wow. Well, you know, one, I just want to thank you very much on behalf of our committee for, you know, being so adaptable to these changing times. And I do sincerely apologize on behalf of the federal government for so many changing guidelines that came out seemingly every single day. So thank you for being able to work on your toes, and thank you for that. But Ms. Templeton, I know I have a short amount of time left. So one last question. In your testimony, you talked about how the grant and the per diem waiver helps your organization during the COVID-19 pandemic. You also stated that $50 was not enough to administer services to homeless veterans. What do you believe is the right grant and per diem rate, and how did that help your organization be able to better tackle the issues at hand?
Well, I think that you all are on the right track with actually giving agencies the opportunity to justify the expenses, right? So we look at things like our daily census, we look at the quality of our programs and the types of services that were offered. So during the pandemic, we were able to look at all of those things and decide what the appropriate rate would be to provide those services. And so just having that back and forth conversation, with the with the VA about what it would take to provide the types of services that we need, that flexibility. I'm not saying that it will be that the rate is the same, will be the same for all providers, or that it should be, but I really, support the idea of allowing providers to at least justify the expenses and talk about what it takes to provide services in their regions.
Thank you. You're on mute, Ms. Cawthorn, but appreciate that. And I now want to turn to my good friend from Arizona, Mr. Gallego, and it's my first opportunity to publicly congratulate you on your wedding recently, and congratulations and best wishes, my friend, and the floor is yours.
Thank you, appreciate it. And, very great discussion that's happening here. Ms. Monet, from my experience in terms of dealing with homelessness, the moratorium probably actually saved a lot of veterans from being evicted. And at the same time, at least from the talking to a lot of my renters, the fact that the government also came back and gave some funds to actually keep them there, not just veterans, but everyone else, actually probably stopped a lot of people from going homeless and then going further down the line of once you're homeless, it's near impossible to get you out of homelessness, and it's very expensive to do it. So can you respond to this idea that somehow the eviction moratorium did not help veterans?
Yeah, absolutely. I think the eviction moratorium was hugely helpful, right? And it, to some degree, not only helped veterans, but it helped providers who serve them because they weren't seeing a giant influx of veterans. I think one of the things that we all know about homelessness is that a prior experience of homelessness increases your likelihood of becoming homeless again.
Right.
So the fact that you can predict it up front and keep folks out of the system and out of shelters and out of rapid rehousing is a good thing. And I think we need to continue doing a little bit more of that, not forever at this scale, but right. I think for a little while longer until we can get everyone back on their feet.
Right, because like one of the things I remember, I helped a lot of homeless nonprofits back in my younger day, was that the biggest problem was that, losing your housing, especially if it's an apartment, was catastrophic in the sense that you didn't have the money to basically go put the deposit back down, right? And obviously, if you get evicted, there goes your credit score. So if you don't have a proper credit score, then you have to put a sizable first and last month's deposit, which for a lot of veterans and just a lot of working class people, they just can't afford that, right? So the idea that rental subsistence, which we give directly to the landlords, by the way, it's a very important program and still is. Now, what is in your experience, at least on another note, with VASH vouchers, were they properly employed during the pandemic to bring in and keep veterans in the stabilized housing?
My understanding is that in most communities, VA did move pretty aggressively to try and ensure that veterans who were in hotel, motel, interim placements were able to move on to something permanent, so we wouldn't be exiting them back to unsheltered status at the end of the pandemic. I think there's probably a fair criticism about whether that could have happened more quickly, but I think they did the best that they could under the circumstances that they were in.
Great. I think that's all I have. I yield back.
I thank Mr. Gallego. That concludes our first panel, and we'll now begin our second and final panel. I want to again thank our witnesses for joining us and for all the great work that they're doing. Our second panel consists of representatives from the Department of Veterans Affairs, the U.S. Interagency Council on Homelessness, and the Department of Housing and Urban Development. And hopefully we'll begin to see them populating our Zoom screen. Testifying for VA today is Dr. Keith Harris. There's Dr. Harris, good to see you. National Director for Clinical Operations for Homeless Programs. For USICH, we're joined by Interim Executive Director Anthony Love, nice to see you. And testifying for HUD, we have Dr. Richard Cho, Senior Advisor for Housing and Services. Nice to see you, Dr. Cho, and thank you all for joining the subcommittee today. With that, we'll get right to it, and I'll recognize Dr. Harris from the VA for 5 minutes.
Good morning, Mr. Chairman. Good morning, Ranking Member Moore, distinguished members of the subcommittee. Thank you for the opportunity to testify today on the topic of veteran homelessness, specifically on the impact of COVID-19 and the implementation of legislative relief for homeless veterans. VA remains fully committed to the goal of preventing and ending veteran homelessness. You've already heard this number this morning, but I'll share it again on HUD's most recently published point-in-time count found on a single night in January 2020. There were 37,252 veterans experiencing homelessness in America. That was an increase of 0.45% over 2019. And importantly, that does not account for the impact of the COVID-19 pandemic, which we're focusing on today, which has added to the housing challenges for veterans. While veteran homelessness has decreased by approximately 50% since 2010, nearly the entire decrease, 47%, occurred between 2010 and 2016. So in recent years, progress on ending veteran homelessness has stalled. It's now incumbent on all of us at VA, as well as our partners at HUD, USICH, and across the federal government to rejuvenate this effort, reclaim the approaches that worked so well in the early years of this initiative, and devise new strategies to address new challenges. To rejuvenate the effort and truly accomplish the goal of ending veteran homelessness, VA and HUD recently released a joint secretary statement recommitting our agencies to developing and implementing a strategy that will generate significant decreases in the number of homeless veterans each year. Our strategy will be centered on a housing-first approach, reaching underserved populations in an equitable fashion, and working with our partners to prioritize increasing the supply of affordable housing. It will incorporate recent statutory changes, providing us with critical flexibilities in serving homeless veterans, and it'll maximize the impact of the considerable financial resources that have been dedicated to this effort through both the traditional budgetary process as well as through special legislation related both to COVID-19 and to the economic recovery. Despite the many challenges our country and our veterans face, those of us responsible for this work have cause for optimism. We have the expertise and experience that generated the early significant declines in veteran homelessness. We have top-level leadership commitment and support, and we have unprecedented resources and statutory flexibility. Now is the time to recapture lost momentum and finish the job. COVID-19 affected everyone, but it arguably affected homeless individuals, including veterans, the most. Homeless veterans are uniquely vulnerable to adverse outcomes due to advanced age, medical comorbidities, and the extreme health risks that come from living on the streets or in congregate settings. We're deeply grateful to Congress for the resources provided over the past year and for the statutory changes that allowed us to be maximally responsive to the needs of homeless and at-risk veterans. With your support and with the dedicated work of VA homeless program staff, grantees, and contractors, much of which has been detailed already in the first panel, we averted a grave crisis last year and saved countless lives. VA homeless programs received $971 million in CARES Act funding that allowed us to move over 26,000 veterans from the streets to safe temporary housing and hotels, distribute over 30,000 smartphones to ensure veterans stay connected to healthcare, landlords, and employers, make improvements to grant and per diem programs to better allow for safe, sanitary social distancing, and prevent thousands more veterans from falling into homelessness through SSVF prevention assistance. Statutory flexibilities introduced in the Isaacson-Rowe Veterans Healthcare and Benefits Act are allowing our programs and medical centers to provide an unprecedented range of services and assistance that will amplify the impact of our efforts to move homeless veterans from the streets to permanent housing. Another recent statutory change is found in Section 9103 of the FY21 NDAA, which expands eligibility for HUD-VASH to other than honorable veterans who are not eligible for VA healthcare. This is an important change. It will allow us to reach additional vulnerable veterans in HUD-VASH, and it'll also help improve voucher utilization rates in the program. It's already been noted in the first panel, but we remain concerned about utilization rates in this program. We have many efforts underway to improve the use of this valuable resource, including significant improvements in case manager hiring rates, and all of which I'm happy to discuss during this hearing. Looking forward, VA is committed to working with all of its partners to develop and implement the strategies that will execute the joint statement from Secretaries Fudge and McDonough. This will include targeted use of funds from the American Rescue Plan to reach underserved populations and ensure equitable service delivery, expand homeless prevention efforts, and expand housing options for all homeless veterans. We're very grateful for the resources and statutory flexibility that Congress has provided to VA to optimize care for homeless and at-risk veterans. And we pledge to rise to the occasion and do all we can to ensure these resources are used as effectively and efficiently as possible. Thank you for the opportunity to appear before you today to discuss these invaluable services to veterans.
Well, thank you for your words, Dr. Harris, and thank you for that pledge as well. We very much appreciate that. Next, I'd like to recognize Mr. Love for 5 minutes. Go right ahead.
Thank you so much, and good morning to you, Chairman Levin, Ranking Member Moore, and distinguished members of the subcommittee. I'm Anthony Levin. I'm Executive Director of the United States Interagency Council on Homelessness, otherwise known as USICH. Again, thank you for the opportunity to testify today on the topic of veteran homelessness. This is an issue I've dedicated my career to addressing. Before joining USICH, I served as the Senior Advisor and Director of Community Engagement for the Department of Veterans Affairs, Veterans Health Administration Homeless Program Office. The U.S. Interagency Council on Homelessness is the only federal agency whose sole mission is focused on ending homelessness. Our council consists of leaders from 19 other federal agencies, including Veterans Affairs and Housing and Urban Development. We all share a vision of what it means to end homelessness. That vision means creating a world where homelessness is a rare, brief, and one-time experience. USICH believes that housing should be a right and not a privilege, and that all people should have access to safe and affordable housing. We work directly with states, communities, and private partners across the country to implement evidence-based practices and to make the most efficient and effective use of all the resources at their disposal. The billions of dollars invested in addressing homelessness over the last year made USICH more vital than ever. Our regional coordinators are in constant communication with governors, mayors, continuum of care leaders, and other stakeholders who are eager to use the American Rescue Plan to spur long-lasting change in the lives of people experiencing homelessness. The American Rescue Plan presents a massive opportunity to help people not only survive this pandemic, but secure long-term housing if they currently lack it. Our job is to ensure that opportunity is not missed. In our work over the last decade, we've achieved notable progress. USICH, HUD, and the VA have developed specific criteria and benchmarks to help states and local governments end veteran homelessness. As of today, 82 communities in 3 states have effectively ended veteran homelessness. Since 2010, there's been nearly a 50% decrease in veterans experiencing homelessness. This is significant, but it's by no means a time to take our foot off the gas. The 2020 Annual Homeless Assessment Report revealed a rise in the number of veterans experiencing homelessness. Although the rise was slight, less than 1%, it represents 37,000 veterans who put their lives on the line to serve our nation and came home to eventually not have a place to call home. This is unacceptable. To achieve our goal of ending veteran homelessness, any increase in this number must be treated with concern and action. USICH uses a multi-pronged strategy to ending veteran homelessness. We build closer partnerships between federal agencies and state and local governments. We define what it actually means to end homelessness. We set ambitious goals and ask state and local leaders to publicly commit to them. We adhere to the housing first approach, which means removing obstacles to help people access housing as quickly as possible. We prioritize people with the greatest needs and high-cost users of emergency care and public systems. And we recognize that some people just need short-term rental assistance in order to restabilize their housing situation. The pandemic has presented communities with added urgency. During this time, USICH has provided a wide range of technical assistance to federal, state, and local stakeholders. We disseminated guidance through our website and emails. We hosted a series of webinars for state and local officials focused on real-time lessons learned. We worked with the IRS to ensure that people experiencing homelessness could access their economic impact payments. We held virtual meetings to create a space to connect emergency shelter providers with federal agencies. We also plan to publish guidance on the American Rescue Plan's provisions that impact people experiencing homelessness. You will hear a lot of numbers and stats today, but it's important to never lose sight of the faces behind those numbers. Every statistic represents a person, someone's son, daughter, father, mother, brother, and sister, and their unique story. It's essential to learn about each individual's struggles and dreams. Veterans have given Americans the opportunity to dream. We owe it to them to provide them with the most basic need, housing. We know that with a collaborative, compassionate, and evidence-based approach, it is possible to end veteran homelessness. We also know that by ending veteran homelessness, we can end all homelessness. The approach we've used to help veterans can help all Americans. Our veterans deserve our best, and we're grateful to be one part of an effort that helps them achieve the American dream, a place to call home. Thank you so much.
Thank you for your words and for your work, Mr. Love. Appreciate that very much. Next, I'd like to recognize Dr. Cho from HUD. You're now recognized for 5 minutes.
Great. Good morning, Chairman Levin and Ranking Member Moore and other distinguished members of the subcommittee. Thank you for allowing me to testify on behalf of the Department of Housing and Urban Development on the topic of veteran homelessness in the wake of COVID-19. As has already been noted by you, Chairman Levin and Ranking Member Moore, our 2020 annual homeless assessment report found that there were more than 37,000 veterans experiencing homelessness at the beginning of 2020. And that number is one that virtually unchanged from 2019. And it actually included a 6% increase in veterans who were sleeping outside relative to the prior year. Secretary Fudge and all of us at HUD believe that not one single veteran, let alone more than 37,000, should have had to endure the entirety of the COVID-19 pandemic sleeping in a crowded shelter or on the streets. And we say that as more than a statement of principle. We've actually shown as a nation that we know how to solve veteran homelessness. Since 2010, homelessness among veterans has been decreased by nearly 50%, with, as Dr. Harris noted, most of those decreases taking place between 2010 and 2016 at a rate of about 10% decreases annually. A concerted push that was made from 2015 to 2016 produced a record 17% decrease in a single year. Those steady reductions in that period resulted from two things. First, significant investments in that period by Congress in evidence-based housing first interventions. Second, leadership by the secretaries of HUD and VA, who in that period directly oversaw interagency implementation efforts, set and tracked performance metrics, and ensured that agency staff worked with urgency to troubleshoot challenges. Unfortunately, from 2016 to 2020, progress towards ending veteran homelessness has stalled. In those years, the trend line shows veteran homelessness remained relatively flat, while unsheltered homelessness among veterans steadily increased. If veteran homelessness had continued its downward trajectory that took place between 2010 to 2016, if that had continued, we might have seen fewer than 20,000 veterans experiencing homelessness when COVID-19 arrived rather than 37,000. Had the 2015 to 2016 decrease of 17% been continued, we might have seen fewer than 10,000 veterans experiencing homelessness nationally. Again, instead we had more than 37,000 when COVID arrived. When the pandemic started, continuums of care and VA homeless program staff sprang into action, increasing disinfection within congregate shelters and programs, providing clients and staff with PPE, leasing hotels to increase physical distancing in shelters, and bringing testing to people experiencing homelessness. HUD responded by providing its grantees with guidance, billions in CARES Act funding for COVID response, and a variety of waivers and regulatory flexibility to assist communities, including the public housing agencies that have HUD vouchers with their response to homelessness. More recently, we've been supporting a national partnership with HHS to vaccinate people experiencing homelessness, including veterans. I want to be clear, however, that while these efforts have been critical, the best way that we can protect and assist veterans who are experiencing homelessness is with the safety and stability of a home. Fortunately, we have a historic opportunity to help communities reduce homelessness through the resources provided in the American Rescue Plan. Just last week, HUD released the initial tranche of funds for 70,000 new emergency housing vouchers that are provided through the American Rescue Plan that can rehouse people experiencing homelessness or who are at risk of homelessness, including veterans. We're continuing to work with VA and public housing authorities across the country to continue to improve their HUD VASH utilization as well. Also earlier this year, we awarded $5 billion in grants through the Home Investment Partnerships Program provided through the American Rescue Plan to support communities to develop new units of affordable and supportive housing to serve people who are experiencing homelessness, including veterans. We've seen that we can get very far in reducing veteran homelessness through vouchers, but at some point we also need to add to the stock of affordable housing, and these home funds will help communities to do so. However, as the trends on veteran homelessness show, investments alone are not sufficient to reduce veteran homelessness. They must be paired with leadership and focused implementation efforts to have the greatest impact. And that's why Secretary Fudge and Secretary McDonough have agreed to explicitly set and make ending veteran homelessness a top priority for our respective agencies. The joint statement referenced earlier by Dr. Harris that was issued in April reflects this commitment, and it charges the staff at HUD and VA to work collaboratively to identify the actions needed to continue the downward trend in veteran homelessness. And with Secretary Fudge elected as chair of the U.S. Interagency Council on Homelessness, and with Secretary McDonough serving as vice chair, we look forward to working closely with our other federal agencies and partners towards the ultimate goal of ending veteran homelessness in our nation. Together with Congress, we can ensure that no veteran should have to lay their head on a park bench or a street corner beneath the highway or beside a riverbank. We can provide every veteran with a chance to live each day with dignity, security, and hope. Thank you, and I look forward to answering your questions.
Thank you, Dr. Cho, and I think that's certainly an objective that we all share. With that, I'd like to recognize myself for 5 minutes for questions. Dr. Harris, I'll begin with you. In your written testimony, you noted that your office completed community interviews with HUD and USICH on obstacles to increase voucher utilization and prepare for implementation of Section 4207 of Isaacson Roe. Can you please briefly discuss the findings from these interviews?
Sure, happy to. Thanks for the question. And as I noted, HUD-VASH voucher utilization is an important piece of this. The interviews came out of a task force, a subgroup task force that we did with USICH and HUD. We interviewed a number of communities, and there's a variety of challenges. That first and foremost is a lack of affordable housing, a simple lack of units. We could have all the case managers in the world, for instance, but without sufficient units to place veterans into, there's a stop point, there's a bottleneck. I'll address VA staffing right off the top because I know it's a common concern, and it did come up in those interviews also. I testified a little over a year ago to this committee. At that point, we were at about 83% of our positions filled. I'm happy to report that number has come up to 88%. That's very close to VA's benchmark of 90 in terms of leaving some room for natural turnover. That's an expansion of nearly 200, net gain of nearly 200 positions. When you multiply that times the caseload, typical caseload in VASH, you're talking about thousands more veterans we can serve today than we could have a year ago. So hiring was noted in those as well. There's also potentially and occasionally disconnects between VA and HUD. This is a rare program that operates across two agencies. It requires a level of coordination that the standard voucher program does not. And those things are typically very case-by-case and isolated and are being worked out on that same case-by-case basis. I know you only have 5 minutes. You probably have more questions for me or others, so I'll pause.
I do. Well, next, as we discussed during the last panel, one of my concerns is that VA's budget request might not be sufficient in terms of the increased demand for HUD-VASH vouchers and case management as the eviction moratorium, the foreclosure moratorium are lifted and the extent of the economic hardship caused by the pandemic is fully realized. Can you please discuss any forecasts that you might have related to increased housing instability among veterans in the coming months, and how the requested budget will serve all veterans who might be in need?
Sure. It's very difficult, I would argue impossible, to do an accurate forecast. So what I'll say in the interest of time is we're as concerned as anyone else on this in this hearing today about the possible impact of lifting the eviction moratorium on some of the ongoing challenges that our homeless and at-risk veterans face. We're concerned about it. We're also prepared to face it. We have pushed a significant portion of our funding, both standard money, but also CARES and planning for ARP money, to SSVF, our primary prevention program. One of the things we're really pushing on is potentially expanding the shallow subsidies program aspect of SSVF, which will put a portion of money towards rent. One of the really nice things about that is that if recipients become employed or otherwise gain income, it's not held against them. It's not taken out of the portion they receive. So it incentivizes seeking employment, seeking other ways to sustain that housing. That's a big part of it. In terms of the budget overall, we're really pleased with the FY22 budget. I will quibble just slightly with Ms. Monet's very firm no when you asked her this question of whether there's enough. We have a substantial increase in HUD-VASH and in some of our other programs that needed it. And we're confident we'll be able to reach our staffing targets going forward. I think the real answer in HUD-VASH, if I can just say really quickly, is broadening both who we serve in that program and how we serve them, incorporating other forms of case management that don't look like the traditional intensive form that VA has executed in the past.
Thank you, Dr. Harris. And if my colleagues will indulge me, I have a question for Dr. Cho and then one for Mr. Love. For Dr. Cho, the point in time count is so important to so many different stakeholders, public and private. And our understanding is that it wasn't conducted across the country in 2021 as it normally would be because of the pandemic. A lot of cities elected to only count sheltered individuals, others didn't conduct a count at all. I guess given that difficulty, how will HUD plan to ensure that we have accurate data on homelessness as we emerge from the pandemic?
Yes, thank you, Chairman Levin, for the question. Certainly, it's unfortunate that we won't have data from 2021, and we had to balance the interests of having good data, consistent data on homelessness with the dangers that would be exposed to staff and volunteers to canvass the streets. Fortunately, veterans is one of the places where we do have good data. About a third of the communities who normally would conduct an unsheltered count chose not to do so or asked for a waiver not to do so. So we do have some communities who have conducted an unsheltered count. In addition, we have VA's data through their homes collection that also enables us to triangulate and able to assess whether or not veteran homelessness increase or decrease. So not the same level of comparison as we had through normal years. We do expect to encourage, if not require, communities to conduct an unsheltered count in 2022. And so we hope to get back to a regular business. But in the meantime, we do have availability of VA's data that we can use to determine whether or not veteran homelessness has been impacted during 2020 and 2021.
Got it. Thank you for that. And then lastly, Mr. Love, emergency rental assistance is operated out of the Department of Treasury. And we're hearing it's difficult to access these funds, and some people lack awareness altogether of the program. Is USICH including Treasury in its agency coordination of COVID-19 response for veterans experiencing homelessness? And if so, how are you working with them to ensure veterans who qualify are aware of and able to use this resource?
Sure. The short answer is yes. We actually just had a conversation with Treasury and Education on the disbursement of those funds. We are in the process of planning a webinar to begin to get the word out about those resources. We work very closely with VA and with HUD on a number of things. And then so we will probably begin to build some type of strategy in terms of how do we begin to reach those veterans and letting them know that resource is available. We're also in the process of putting out on our website a guide in terms of the APR resources and how communities can access those resources.
Great. And I thank you all for your answers. I thank my colleagues for their patience, and I'll recognize the ranking member, Mr. Moore, for his questions.
Thank you, Mr. Chairman. Dr. Harris, as I mentioned in my opening statement, if veteran homelessness were to double to 72,504, and we were to take all the money allocated through the CARES Act, the American Rescue Plan, and the President's budget request, we could write a check for $41,963 to each homeless veteran. While I absolutely support these programs and believe we should do everything we can to ensure veterans have a roof over their heads and wraparound services, this is an extraordinary amount of money. It's being spent. Do you believe this money is being spent in the most efficient manner? And what more can be done to ensure that the $41,000, almost $42,000 is providing quality services to the homeless veterans?
Thank you for the question. I did hear that in your opening statement, and I have a number of things I'd like to offer in return. I think the first thing is the point in time count is a very small sliver in terms of number of all the people we're serving with those dollars. I think that's important to note. So first of all, that's on a given night. We generally anticipate close to 3 times that many people becoming homeless over the course of a full year. So you're talking, in our estimates for FY20, we estimated over 124,000 veterans homeless over the course of the full year. So that changes the math. The other thing that changes the math pretty substantially is that the dollars you're referring to are providing services not only to those literally homeless, but also those at risk for homelessness, also those we've already housed and are working to keep in homelessness. So in FY20, those VA dollars you're talking about served over 300,000 veterans. And that's not even counting family members, dependents, that are served in some of our programs, SSVF and HUD-VASH in particular. So the math changes pretty considerably. The other thing you have to ask is, if we weren't paying for that, what would the cost be? What would we be paying for? And what a lot of different homeless research has shown is that when we don't provide case management, supportive services, prevention services, primary care, things like that, that veterans instead are forced to resort to much costlier interventions, emergency rooms, inpatient units, not to mention costs on legal system, et cetera. So that's a long answer. Short answer, I think personally, and we've got a lot of data that can support this, we do a very efficient job of using those dollars, but we want to make sure every dollar counts, and we'll continue to do so.
Thank you for that answer. I appreciate you explaining a little bit of that. A question to Dr. Harris: how many providers have come back to the VA and requested an increase in the GPD rate? And do you believe it would be wise to provide an increase beyond the newly enacted rate?
So I'm going to give you a ballpark number I saw a day or two ago, and it was, I believe that there were over 900 requests. Providers could come in more than once to ask for that. The average request was in the order of $30 to $40 more than typical per diem rate. And we as a program office believe it would be very valuable to retain the ability to go higher, especially in these moments of emergency.
I've noticed about half of that $170 million has been allocated to GPD programs, or has not been obligated yet. And why is this occurring, Dr. Harris?
This is one, I'll give you the short answer here. We're happy to take a more complete answer for the record if you'd like. The primary reason is that the funds are paid out quarterly and paid essentially on a payback basis by the way the billing works. So the program typically uses all or nearly all of its funding. There's no reason to suggest it won't happen this year also.
Gotcha. Okay, with that, Mr. Chairman, I'll yield back. Thank you. Thank you, Dr. Harris. I appreciate it.
My pleasure.
Thank the ranking member for his questions, and now recognize Mr. Pappas for 5 minutes.
Thank you, Mr. Chair, and thank you to the panel as well. I want to start with you, Dr. Harris. We heard a little bit in the first panel about how emergency funding was utilized to get out there to support veterans, as well as some of the flexibilities around programs authorizing the COVID relief packages. I think we can say that these made a significant difference for nonprofits and agencies that partnered with VA to provide, some additional resources to combat veteran homelessness. So I want to thank you for the commitment that you've made to do everything in your power to ensure that every veteran has access to safe and stable housing. That's so crucial, and that you recognize the benefits of additional resources and statutory flexibility that Congress has helped to provide. So I'm wondering, given the sort of experience of the last 15 months or so with these emergency measures, how does that inform the work going forward? What things have been successful in your estimation? What flexibilities have, worked in a way that you want to retain them for the work ahead?
Sure. Thank you for the question. And I wish we had more time because there's a long list of things here in terms of flexibilities and benefits. I want to thank you and your staffs and those on the SBAC side as well for the statutory flexibility, especially in the megabus, the Isaacson Row, and especially in Section 4201, where we were given authority. It's been noted already in previous testimony, so I won't repeat that. That's a hugely important piece of the flexibility, and something VA medical centers have wanted to be able to do for literally decades, the ability to purchase the very things homeless veteran needs directly, clothing, shelter, supplies, all of those things. We've always had to rely on donations and on the grant programs to do that. It's an incredibly important flexibility. I would, if I had time, I would share stories with you about the kinds of assistance we've already provided. It's heartwarming and it's life-changing. In addition to that, some of the flexibilities provided to the grant and per diem program are tremendously important to hang on to. And I think Catherine referred to these, the waiver of the match requirement and of real property disposition. These are things that have been obstacles to grant and per diem providers being able to make improvements or otherwise change their housing stock in a way we want people to go. SSVF, this is not statutory, but it is introduced some flexibilities last year with the Stafford Act that is writing into regulation now related to shallow subsidies and caps on hotel stays. That's just a small example. Again, I know we're short on time, but there's many, many flexibilities that we're thankful for that we would love to see retained.
Well, thanks for that list, and we would appreciate working with you on, identifying what's worked and how we can move forward in a way to, ensure we can retain some of those tools. I think, you understand where the track record has worked out here, and we want to do all we can to be as effective as possible with these provisions. So one additional question I had, and maybe I could stay with you, Dr. Harris. We know that through the point in time count that VA collects data on veteran homelessness, and data is really important as we sort of break down veteran homelessness to look specifically at women, Black, Hispanic, and Latino homeless veterans. It's really helped the VA be able to tailor programs and services to meet the needs of specific communities. And I'm wondering if there's data collected for LGBTQ+ homeless veterans and any sort of efforts underway to be able to better understand their experience.
Sure, it's a really important question. And just a quick note on equity more broadly. This is something we take very seriously, and events over the past year, of course, have raised its prominence further. And as several people noted, people of color are highly overrepresented in the homeless population. The good news, and we've looked at this, is people of color have very good access to our programs, actually exceeding their rates in the population, and their outcomes of our programs exceed their rates of entry. So we've looked at that, and we believe our programs are accessible and performing well for people of color. For LGBTQ, our data collection system, HOMES, based most of its elements on HMIS universal data elements, and that item, sexual orientation, actually isn't in the universal data elements. It's not therefore in HOMES. It is something we'll be adding to HOMES 2.0. What I can share, which is in development now and hopefully will be rolled out next year, our National Center published some information on transgender veterans, and one of the data points showing they're highly vulnerable, 3 times more likely than non-transgender veterans to be homeless and face other vulnerabilities. And so it is a group we take seriously. We'll begin collecting more data on it soon.
Well, thanks. I'd love to hear more when you have additional detail on that. And I think it's just important to understand what the full picture looks like and how we can assist. So appreciate those comments. I yield back my time.
Thank you, Mr. Pappas. Now I'd like to recognize Mr. Cawthorn for 5 minutes.
Thank you, Mr. Chairman. Mr. Dr. Harris, I hope you're doing well, sir. How many providers have come back to the VA and have requested an increase in the grant and per diem rate?
So that's, I was just noting numbers around 900 or so in terms of number of requests. That's, some of those are duplicates of providers where they've come back more than once.
Okay. And do you believe it would be wise to provide an increase beyond the newly enacted rate?
Well, you've heard from the providers themselves, and we have too, that they are in fact looked upon very favorably. It allowed people to respond, to purchase PPE, to make improvements to their units, to place veterans in hotels if they needed to be quarantined. We believe all those things were tremendously beneficial and would be so in the future, yes.
Fantastic. And also, I will say I was very pleased when I was reading your written statement a couple of evenings ago that over 65% of veterans who were sheltered in hotels during COVID were able to transition to permanent housing, which I think is fantastic. I am just curious about, because I believe in really a no one left behind mentality. What happened to the remaining 35%? And your best estimate, what was the number one cause that normally prevented people from transitioning to permanent housing?
Yeah, it's a really important question. We dug into that as best we could, and unfortunately can't get quite as far as we want to, or imagine as you would like right this second, but it is something we'll continue to look at. About half of the remainder went to temporary or transitional settings. So they still had a roof over their head, but those settings like a grant and per diem, something like that, even though there's a safe and stable place, it's counted as technically homeless and not as permanent housing. So about half of them still ended up in a good spot where we can continue to work with them and place them into permanent housing. The other half, so now we're down to 17 or so percent, did in fact exit back to homelessness. We don't know, frankly, where exactly they went. This is why we continue to conduct outreach, why we're engaged in coordinated entry programs, why we have prevention programs. We're going to seek and find, to the best of our ability, the rest of those and help them obtain housing.
Excellent. Well, Dr. Harris, one, I just like to say thank you very much for working so hard for our veterans, making sure that over 65% of them did get into a permanent housing. I think that's an incredible number, something you should be very proud of, sir. Hopefully, the rest of the 35% fixed. Let me actually on the GPD rate. I noticed that about $170 million that has been allocated for GPD has still not really been used and is kind of sitting in flux. Do you know why this is occurring?
The GPD, I mentioned this a minute ago also, the GPD dollars are essentially paid back. So we will have unobligated funds all the way to the end of the year, and that will then be obligated at the end. So the GPD office, we're not concerned about ensuring those dollars are spent. They will get spent.
Excellent. Well, hey, Dr. Harris, thank you very much for your time. And Mr. Chairman, thank you, sir.
Thank you, Representative Cawthorn. I think I got a note that Representative Mann was going to join. Is he on the Zoom? We'll give him a second. I hear he is joining. He is being promoted. Representative Mann, I can see your name on the Zoom. Can you turn on your video and sound? There we go.
There we go. Hey, sorry about that. I could hear and see y'all, but it didn't give me the prompt to jump in. So sorry about that.
I've been on the other side and I can totally relate. And that's why I'm excited. We'll have these hopefully in person real soon. And timing is good though. You're now recognized.
Amen to that. Well, thank you, Chairman Levin and Ranking Member Moore for holding this hearing on the important issues of veterans homelessness, something I'm very passionate about. As you know, this year, Congressman Pappas and I introduced the Affordable Housing for Homeless Veterans Act, which passed with bipartisan support on the House floor last month. The swift passage of this bill shows us how our support for veterans is not a partisan issue, and issues like homelessness are at the forefront of the VA committee's priorities. Looking forward to swift passage of the Affordable Housing for Homeless Veterans Act, hopefully here in the Senate before too long. Mr. Love, I understand that USICH coordinates with 19 other federal agencies, including state, local, and community organizations to help combat veterans homelessness. Can you expand more on the coordination between USICH and these agencies and organizations, and what type of communication do you maintain with them?
Sure. So there are 19 federal agencies that are part of the council. We have a chair. The chair of the council is Secretary Fudge of HUD, and Secretary McDonough of the VA as the vice chair. We meet quarterly with the council to bring to them decision-making items in terms of moving forward, as well as to give them updates on what's happening around homelessness. We invite in communities to kind of talk about what's happening on the ground and what they need from the federal government in order to be able to move forward in ending homelessness in their communities. Our work in state and local areas happen with our regional coordinators. We have 5 regional coordinators at any given time. Right now we have 4, and we're in the process of hiring another one to cover the United States to work with communities in terms of what are the most strategic and best ways to utilize federal resources in terms of ending homelessness, talking about how to implement best practices in their communities, as well as being able to connect them with various resources within the federal government, connecting HUD with educational resources, or VA with HHS resources for those veterans who might not qualify for, are not eligible for VA services. We also have interagency work groups that we comprise. We currently have a veterans work group it's called Strategic Decision Coordination Team, and that's VA, HUD, and USICH, to talk about those areas in which we have some coordination opportunities and some opportunities to work together on veterans homelessness. It's not operational in terms of telling each group how to operate, but at the same time, there are those areas where we can leverage what each organization does for the benefit of the veteran.
Okay, wonderful. That's very helpful. Thank you. My other question would be for Mr. Harris. Mr. Harris, when can we expect a detailed spend plan for the funds provided to VA for homeless programs through the American Rescue Plan specifically? When do you think we'll have that those details?
Yeah, thank you for the question. We have our internal spend plan ready. It's my impression it's in concurrence. So happy to take that for the record. If we haven't already provided it, we're certainly happy to.
Okay, great. Well, that's all the questions I have. Mr. Chairman, I yield back. Thank you.
I thank the gentleman from Kansas for joining us, and I thank our witnesses again. And if there are no further questions, we can bring this hearing to a close. Ranking Member Moore, did you have any, if we were doing this in person, I'd always turn and ask if you had any closing thoughts.
No, thank you, Mr. Chairman. I appreciate it. I appreciate the panelists and for their work on what they do for homeless veterans, and look forward to working with them in the future.
Thank the ranking member. And as the ranking member said, I too thank you all for all your excellent work, both our first panel and all of you at the agencies. Very tough months ahead, most likely, as we fully recover from the pandemic. So thank you in advance for your hard work. All members have 5 legislative days to revise and extend their remarks and include additional materials. And without objection, the subcommittee stands adjourned. Thanks, everyone.